Okay. Hi everyone, thank you for that. As was mentioned, I've recently gone to live in New Zealand. I went down there 9 years ago. And basically, I went to a country that had 4.5 million people. So I went from the UK that was pretty overpopulated down to a country the same size, same landmass as the UK, but actually with 4.5 million. More sheep apparently than people. Now, the estimated prevalence of COPD down in New Zealand is 15%. And I use the estimation very, very loosely because in all truth, we've got absolutely no idea of the amount of COPD that's in New Zealand. When I went down there was very little primary care availability for New Zealand. For those of you who don't know about the health system down there, it's a state system, but you pay for primary care. The average wage is $14 an hour for the normal person. It costs between $50 and $80 in primary care to get a spirometry test. Hence, people don't go to get a diagnosis to start with. That's why we've got no idea. However, there's also a large indigenous population, 1 in 7 of Maori population or identify with Maori. And the reason I bring that up is because in the Maori population, we do know that it's about 2.5 times the amount of Caucasians have a diagnosis of COPD already. The reason that affects me in my role, I used to work in pulmonary rehabilitation, and the reason that it affects me is the majority of the Maori population are actually living in very, very poor housing, and they are in the lowest paid jobs that there are. So obviously they don't get a good start. Just listening to the discussion about bronchiectasis earlier, and I've just thrown this in, where I live in an area, it's like a county, we call it Hawke's Bay, and there's a population of 170,000 in Hawke's Bay. We've got 27 children under the age of 16 who are identified as having bronchiectasis. Now that to me is a pretty scary amount, and that's non-CF, non-cystic fibrosis bronchiectasis. And we're putting that down, probably a lot of that is to the housing conditions that people are living in. And that's just the ones that are diagnosed. We're not going out looking for it. We know we've got over 120 adults diagnosed with bronchiectasis. There's a huge amount more out there that we don't know about. So as you can see, we're coming from a quite poor living conditions, quite a poor population. As I say, I was working in pulmonary rehabilitation up until 2 years ago. And we had this lady who was doing our group. She was doing her third course at the pulmonary rehabilitation program. Her name was Carol, and I'm going to introduce her to you in a minute. But she came up to us and she said, yourself and Carol, now Carol's a physiotherapist who's working alongside me as the respiratory nurse. You've got lots of knowledge, you need to share it. And we went, well, we're seeing 15 patients in Hastings and 15 in Napier every 8 weeks. We are sharing it. And she said, no. You need to write a book. So you can imagine, both of us are working full time, both of us have got very busy lifestyles. So there's a bit of a stunned silence. She played us off against each other. She was quite clever, was Carol. And she basically went to one to the other and said, this person will do it if you'll do it, and vice versa. So 2 years later, we've actually got a print copy now, which is here. And I'm just going to tell you about the journey to that book, and I'm going to introduce you to the book as well. So that's, as you can see, that's me up there, and that's just a bit of background about me. This is Carol, the physiotherapist. She also comes from the UK as well. So she's been at Hawke's Bay for about 7 years now, and very, very dedicated physiotherapist. Then we have Carol CT. Now, Carol CT, our patient, Holly's spoken to her many times on Skype. Carol is a force to be reckoned with. She comes originally from the UK. She's actually got ACOS, basically, but she had her asthma diagnosed as hysteria back when she was in her 20s. She was told she didn't have asthma. She was taken off all her medication. She was treated with depression. She was treated with antipsychotics. You name it, she had it. And it wasn't really until she came to New Zealand that she actually got a formative diagnosis. And she's now actually obviously been diagnosed with COPD. The time that this all came about was when she was referred for consideration for transplantation, but she was told she wouldn't benefit from it. And she'd actually benefit from thermobronchoplasty, which we don't do in New Zealand. So she's on a bit of an upper at the moment. This is Phil. Phil's her carer. And Phil's basically not got a medical background at all. Carol CT was a nurse, by the way, who's never touched a sick in her life. Phil's her carer. The two of them have actually just landed back in the UK yesterday. So they're re-emigrating, but they're re-emigrating to northern Spain for the heat and for grandchildren. So if we can just go to the book. The book that we formed, basically we had no idea how to write a book. And Carol CT, being very clever, said to us, okay, well, just do it in your own time. Just email me bits and bobs off. So over 2 years, myself and Carol Physio would sit in the evenings when the kids wouldn't sleep, and we'd jot stuff down on an email, and we'd flick it off to Carol CT. And it'd come back with, you need to get some research for this. I haven't got the time for that, Carol CT. You go and do that. So she became our research guru. She found out the evidence that we actually needed to back up what we'd been doing for many years. We wanted to make this book for patients, and we also wanted to make it for our New Zealand patients. We had no literature there to describe to our patients what COPD was and the treatment paths they should be taking. And like I say, we had a very non-primary care of COPD. It was all very much crisis management in the hospital. We wanted to give patients the power back. So we came up with this book. If you'd like to go through to the introduction, that's it, that's the page. And if we can just go to page 1, which is the journey to diagnosis. 1, that's it, lovely. So as I say, we've actually written about COPDers, and we've put about these couple of people in. Deborah and Judy is actually based on Carol CT and her partner, and Jean and Bob is a couple that I cared for many years ago. And we've interwoven these couples in, their journey in, throughout the whole book, in order that people can identify with what you're going through. If we can go to page 3. We're very aware, and we've heard from many people over the years, that actually they've had non-diagnosis for many years. They've gone to the GP. They may be smokers, non-smokers, never smokers, ex-smokers. But they're branded with, if you're an ex-smoker, well, you might have COPD, or a current smoker. But if you're not, COPD doesn't come into the equation at all. So we wanted to really give them, these people, the opportunity to read up about non-smoking related lung disease as well as smoking related lung disease, and give them some power they could take to their GP. And this is what we've done. We talk about going to see the GP to start with, then we talk about the tests that they'll actually receive, and that's page 10. That's right. So we go into spirometry. You've got the little Venn diagram there about what COPD is. And we've done a tiny amount about what is COPD, because actually there's a huge amount that's out there on the web already. And right at the end, we've put some websites where you can actually go to, which is decent information rather than scary information. There's a huge section on understanding your breathing. And this is something that we were told by the pulmonary rehab patients when they came in to see us, that many of them had never been asked about their breathing. How is it for you normally? What's your norm breathing? What happens when you get up out of the chair too quickly? So if they don't know what's actually gone, what should be normal with their breathing, how do they know when things have gone wrong? How do they know how to recover their breathing? And that was something that we focused on hugely within pulmonary rehabilitation. Incidentally, there's 12 pulmonary rehabilitation programs that run throughout New Zealand. And obviously, people do move about. And we heard that actually there was only 2 or 3 that were focusing on breathing as part of the pulmonary rehabilitation, breathing retraining. There was an awful lot doing exercise, but there was very little emphasis on the breathing retraining. So we just felt that was a really important part to put in. We came to the medication section. That was fun, because we actually wanted to do some links, sort of on YouTube, etc., demonstrating how to use your medication. I'd lost count of the amount of people that I saw come to me with an inhaler and like that with the squirty inhaler. No spacer device, no shaking it, no recombining it, etc. So we knew we needed to do something about it. You go onto YouTube and you see people holding it out here and squirting and trying to breathe it in from there without a spacer in between. We see people being told to suck and swallow. It was scary what was out there. So we found some links that are actually very valid on there, and we're having to keep those updated, obviously, as things progress. the pulmonary rehabilitation section. So that is page 23. Now this is where we went a little bit crazy and we wrote about pulmonary rehab for quite a long time. We covered exercise and education, and we did about the introduction to the education sessions that would be seen during pulmonary rehabilitation. When we had people come for assessment, people would say, well, why do I need to have a dietitian seeing me if I've got COPD? And that's how naive some of our patients actually were. The level of health literacy is really low within New Zealand generally. So we were actually starting from a very, very low level and building these people up. We also put together an exercise component for the programme, for the book, that people could do at home. So if they're unable for one reason or another to attend pulmonary rehabilitation, then these are the exercises that they can do on a daily basis. And when we were putting it together, it was try explaining how you're holding maybe a 1 litre milk container holding sand and moving your arm like that and down like this and breathing in the correct way when you're doing it. So Carol CT said, well, make a video. So we did. So we've actually got it on a DVD now, and every patient who comes through pulmonary rehab gets given a copy of this DVD. And we've actually had people from outside of Hawke's Bay have sent us $1 and we send them back a DVD as well. It just replaces the cost of it. Living with COPD on page 45. We talk about healthy homes. Now, I touched on that very briefly, the level of poor housing within New Zealand. We have houses that have no insulation. A lot of houses have no insulation. They're wood, basically. There's water pouring down the inside of the walls. When I went to live in New Zealand, I was using 8 bath sheets a day just to mop the windows. I was lucky I could afford to put ventilation and insulation into my home, but the majority of patients can't. So we've had a huge scheme go through New Zealand where all the state houses are now becoming insulated, top and bottom. Obviously, that's only touching the tip of the iceberg because there's all the private rentals of people who can't afford that. The landlords won't fund that. We also touched on something that some of you may have heard about, nasal rinsing. Has any of you heard about nasal rinsing? Yeah, I see a couple of nods, that's good. Okay, because if people can't breathe through their nose, how are they supposed to breathe at all? So we went into that in detail as well. Exacerbation management, travel management. We touched on the healthcare team on page 59. We introduced each member of the healthcare team and what those people would do for that person during their COPD journey. We also linked, as you can see, we had the gold standard. We had counsellor and mental health team. We don't have access to that in our area at all until it all goes. We then go to page 68 where we had very, very quick input into complementary therapies. And this part of the book really needs developing more. As you can see, we've touched on aromatherapy. If we can just go down 1 page, 2 pages, okay, 3. We've got some massage in there as well, and the worries about using essential oils, about having to use the pure oils, etc. We've got acupuncture, we've got massage, and I think that's about it, or medical herbalist in there as well. So that's growing all the time, and we have to keep updating this book all the time. Caring for carers. Now, we asked Phil to write this section. Phil was the expert. We don't know about what carers need. We're healthcare professionals, she's the carer. But unfortunately, she was in the middle of relocating back to this country and she had to take the lead. So she's promised us that once she's settled, that section is going to grow massively. But we've only linked on it, we've only put a very small amount into that at the moment. I think we need to recognise the impact on the carers. And I think by putting something in there, then actually we're saying, actually, you know what, you guys are important and we need more. We need a hell of a lot more for the carers. We then put in about palliation. And I actually had quite a lot of feedback from my colleagues saying, well, we shouldn't be putting in about palliative care for COPD. And I mean, I actually had several people say that's just for cancer. And I went, that's absolute expletives. Because at the end of the day, every one of us everyone of people in here who has COPD may need palliative care input. It doesn't mean that you've got days left to live. It means that you may need symptom control. You may need the counselling, the wraparound service that goes with palliative care. We included advanced care planning into that as well. And again, A lot of my colleagues still get very freaked out about us talking about advanced care planning with these patients. I just think it's so important. Every day we make these decisions about what we're going to have to eat when we get up in the morning, what time we're going to go out of the house, etc. But nothing allows us to plan for our own dying before we die. We all make wills, we all have funeral plans, but actually, what about coming up to that time? And it's actually involving the patients and the relatives and any significant other people in advanced care planning. So there's quite a big section about that as well. We got a lot of this proofread by pulmonary rehab people as they went through the rehab programme. And they gave us back with scribbles all over, etc. You're talking in jargon. So we de-jargonised it as much as possible, but we recognised that actually we did have jargon in there, so we put a glossary in there to try and cover that as well. And then we've got some links. So then it came, okay, how are we going to get it out there? Carol CT came back into her own here, and she formed a website. So all of this is sitting on a website called don'tforgettobreathe.org.nz. We called the book Don't Forget to Breathe because apparently Carol Physio and I said that between us 32 times during one pulmonary rehab session. So it had to be the name for the book. And that's the website up there where anybody can download it free of charge. It's been we've done no advertising of this book at all, apart from talking about it at the Thoracic Society of Australia and New Zealand earlier this year. Sorry? Here, that's right. We've got a nurses' union, basically, in New Zealand with a respiratory nurses section, which has got about 100 members, and we talked about it there for about 10 minutes. And we've had over 25,000 downloads in just under 2 years. We really cocked up with the downloads, because actually we said, you can download it here, and it slipped straight out like that. But having spoken to people at conferences since, Di Hart, who's one of Monica's friends, when I spoke to her a couple of months ago, she said, I've used it for every single patient. I've given every single patient I've had through the rehab programme a copy of your book. I hope that's okay. Well, she sees 200 patients a year going through the rehab programme. So there's a heck of a lot more than that has actually been produced. We were very naive when we did it. That's why we didn't really put a counter on it, etc. We put together a blog as well, but the blog's been really underused, and we don't know why. We've put sort of news items, etc. on, and we use that to get out on emails to patients and to anybody else who's registered on here. But it's just really underused. And I really think, having sat here and listened to Bill earlier, it would be great if we could link the two together. I'd love to be able to do that, to actually have a link from your website to ours and ours to yours, etc. as well, because we're all trying to achieve the same thing. Yes, we put it free to download. A lot of people want paper copies. We got a health award last year, and then we managed to get 50 copies. And so there's one gone into every GP practice in our area in Hawke's Bay, and then there's some in public libraries as well. So those who don't have internet access can now borrow a copy, take it home, read it, and take it back again. But I'd actually like, eventually, every GP practice to have one of these within the country. Because having spoken again to GPs at conferences, they've said, I've printed off a copy and I flick there through it with my patients. So although we wrote it for patients, other healthcare professionals are using it with them as well. Like I say, it's been written for a New Zealand audience. It's already been adapted. We had an email from a physiotherapist in America not long after we put it out there, and she's already adapted it for her pulmonary rehab clients. We'd really like to get it adapted for Australia, and certainly at TSANS earlier this year we were talking to some companies about getting that done. We're in the process of applying for some grants to try and get it translated into Mandarin and Cantonese as well, for the Mandarin and Cantonese community of New Zealand. But it has been written, the copyright style of it is the Creative Commons license. It's there for anybody to take, adapt for your country. Like I say, it's, all of those downloads has been over the world. I learnt where places were. When Carol CT said, oh, it's been downloaded this many times and this is where it is, I'm going, well, where's Moldova? How come Madagascar's got hold of this? Estonia? So there was places that I hadn't been to, had never heard of, hadn't done any advertising, and it's there. So it's complete word of mouth, and I'm being told to shut up now. Thank you, Honey. But please use it, take it, use it, and make the most of it. Thank you.